What are the risks of a woman using men's Rogaine? I am a 22-year-old female, and the hair on my head is rapidly falling out. You can clearly see my scalp throughout the top. I saw my dermatologist, and she recommended I use the men's Rogaine solution. I am concerned that it will not work for me, and that I risk losing more hair, which I cannot afford. I am very concerned, and this situation is detrimental to my self-esteem. Please help. I feel stuck and confused.
Thank you for your question. You're 22 years old, you're noticing a widening of the part and appears to be a diffuse thinning of your hair. And your doctor recommended you use men's Rogaine. You're asking if this is okay to do. Well, I can certainly give you my perspective and experience. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon. Hair transplant and hair loss has been a big part of my practice for over 20 years, practicing in Manhattan and Long Island. And in fact, I'm also the founder of Tricostem Hair Regeneration Centers, which is a non-surgical alternative for hair transplant, which we developed in our practice using a wound healing material, and I'll go further into detail into this as we discuss your question. So let's start with, first of all, the diagnosis. The first thing I would want to know when a 22-year-old woman comes to our practice with hair loss is this pattern hair loss, or the term androgenetic alopecia? Because if your doctor is recommending you use Rogaine, this essentially means that your doctor is diagnosing you with pattern hair loss. Now, in female pattern hair loss, it is not unusual to see women in their 40s and older develop pattern hair loss or androgenetic alopecia. But it is very unusual for women in their 20s. Now, in our practice, we developed a treatment called Hair Regeneration, and it's been very successful as a way to help men and women with thinning hair using a wound healing material and a method and a process that we've developed, and it's an injection. And it appears to reactivate thinning hair. It stops hair thinning and lets thinning hair become and grow thicker. And with more than 5 years of data, we appear to have no evidence of any regression, and I'm always continuously improving the process to maximize each individual's result. Because even though there's a pattern, there's also a lot of individual variation as to this, as to the expression of hair loss. For example, some men start losing hair at 18, while other men start losing hair in their 30s. Well, with women, proportionally, it's still higher in the middle age time frame as opposed to for women in their 20s and 30s. Now, as more people started to learn about our treatment, we started to see a lot more younger women. And it would always raise a red flag for me, and I would actually do biopsies of the scalp to send to a pathology lab to make sure that we're not dealing with any other condition, whether it's an inflammatory condition, a scarring condition, or an autoimmune type of condition. So with that being said, I would suggest you consider, before doing any treatment, at least getting a diagnosis that's confirmed via biopsy. You know, this is what I would do for a woman who comes in who's 22. Even if there is, and I would say as an aside, that a lot of our patients who are in their 20s and their early 30s who have come in and we've done biopsy, a lot of them do have androgenetic alopecia or familial pattern hair loss. So I think it's just a group that's been underrepresented and underappreciated because there were no options other than topicals. With hair regeneration, more people are finding us and learning about this option and using it and getting good results. I mean, more than 90% of women see improvement, and more than 99% of men see improvement. So I think that in terms of safety, there's always been a caution, going back to the question about the Rogaine, there's always been a cautionary uh, rule about the 5% Rogaine on women possibly causing facial hair growth and other potential side effects. In my practice, I would say that overall there hasn't been that much of a trend, but that's one doctor with one population. I think it is a risk, but you also, before you have to ask the question, what is the benefit of 5% versus 2%? The higher the concentration doesn't necessarily mean the better the result. And to understand the effect of minoxidil, minoxidil does not stop hair loss progression. It allows thinning hair to stay longer on the scalp, and it appears to make the hair look more full. But I think I'm concerned that if you don't have some kind of intervention that at such a young age, and if you're progressing, then it's a problem that you won't be able to keep up with, even with a topical treatment like minoxidil. So I think you should meet with the doctor who diagnosed you or get an additional opinion. But if someone like yourself comes to my practice, I would do biopsy to have confirmation, and then I would consider recommending hair regeneration treatment. That's basically because with hair loss, there are so few options, and it leads to a lot of people doing very desperate things, whether it's buying pills and buying oils and supplements that are really of no value, shampoos, etc. Essentially, you have medications, and for women, it's minoxidil. For men, it's minoxidil and finasteride, and then there's surgery. And for men, pattern hair loss, surgery is an option. For most women, it's less of an option because there's still a lot of existing hair. Hair regeneration fits that very well because it basically takes your existing hair and lets it grow and triggers a process that makes it grow thicker. So with that being understood, again, meet with your doctor or get additional opinions and consider having a biopsy before you undertake any treatment program. So I hope that was helpful. I wish you the best of luck, and thank you for your question.